Let's study about the hip bone. It is a flat, irregular bone. It is known as the Shroni Falakasti in Ayurveda. The two hip bones, along with the sacrum and the coccyx, forms the hip girdle. This hip bone it consists of three parts: superiorly the ilium, antero-inferiorly pubis, and the posterior-inferiorly ischium. Now the side determination. If we see laterally, it consists of cup-shaped hollow cavity called as the acetabulum. Below acetabulum, it consists of an oval opening called as the obturator foramina, which is bounded anteriorly by the pubis and posteriorly by the ischium. The superior part of the hip bone, it is a flat, plate-like structure called as the ilium. Now the anatomical position, the anterior superior iliac spine and the pubic tubercle, it lies in the same coronal plane, and the pelvic surface of the body of the pubis, it is directed upward and the backward. The medial surface of the body of the pubis, it is present in a medial plane. Now the features of the ilium, the supermost part of the ilium, it is a convex ridge-like called as the iliac crest. This iliac crest, it is concave inward in front and concave outward behind. This iliac crest it consists of two ends. The anterior end, it is also known as the anterior superior iliac spine, and the posterior end called as the posterior superior iliac spine. This iliac crest it is divided morphologically into two parts. The anterior 2/3 part called as the ventral segment, the posterior 1/3 part called as the dorsal segment. The ventral segment it consists of outer lip, intermediate area, and the inner lip. The dorsal segment it consists of medial slope and the lateral slope. The ilium it consists of three borders. The anterior border it starts at the anterior superior iliac spine and end at the anterior inferior iliac spine. The posterior border it starts at the posterior superior iliac spine and continues downwards towards the greater sciatic notch. The medial border it is present on the inner surface. It starts just below to the iliac crest and continues downwards towards the iliopubic eminence. Now the ilium consists of three surfaces: the outer surface or the gluteal surface. The inner surface it is divided by medial border into two surfaces, that is iliac surface and the sacropelvic surface. The gluteal surface it consists of three gluteal lines. The posterior gluteal lines it begins at the posterior superior iliac spine and end at the upper part of the greater sciatic notch. The anterior gluteal line it starts at the anterior superior iliac spine and end at the middle of the greater sciatic notch. The inferior gluteal line it begins at anterior inferior iliac spine and end at the middle of the apex of the greater sciatic notch.